Hi, Tibi. How are you doing?
Good, Deepti. Nice to see you.
Thank you so much for your time and uh, chatting with me and giving your expertise so people can find help when they are looking senior care options.
Thank you. This is what I do all day, every day.
Because I just wanted to see like when people like reaching you out, so what kind of questions actually they are asking or what kind of conversation actually going on, like even they are looking for future or even they are like asking questions. So what kind of questions they actually asking and what they have hesitations, does they have any financials related questions or just like looking for the senior care options?
They just want to learn in those particular cases. They just want to, they have elderly parents, and they just want to learn about what options would be available for them in regards to senior living.
Okay. And did they talk with any other person, like any other people, or you're the first one they are talking?
They found other people too. They're talking with other people. So I encourage them to narrow it down to only one agency. But, I mean, generally, I mean, I'm expecting if people they do a Google search to have a bunch of results and call around and talk to more than one.
Yeah, because I just wanted to learn like more like when people are like calling you, so they are just asking like general questions, or they are asking like related to the financial question, because most of the time people have the financial question like how they will manage the money when they find out senior care options, or they are more looking towards like the best fit senior care options.
I think financial talking about or asking about finance, there is nobody really that, I mean, it's rare when somebody calls and they're asking straight right away about finances, you know. Um, by far, in most cases, people they ask questions about the senior living options out there because they just don't know anything about it.
Okay.
And so it's like I got like one of those calls, my father is 95, my mother is 92, they're living at home, they got some memory issues, they start needing help, we don't know what to do. That's kind of the bottom line of
Okay.
uh, the purpose of their search, I think. And then we go from there. And of course, at some point in the conversation, we'll talk about finances because that would narrow it down or expand it depending on their financial situation. But generally, it's the lack of knowledge that most people have about the options for senior living. That is kind of, I think, the
Okay.
main thing.
So in that scenario, like they have like their parents have some memory issue. So did you directly like targeted the assisted living, or did you tell like which one is the best fit for them and they need to be look for those kind of facilities?
Well, we haven't had those detailed conversation yet. Again, one is at 2 o'clock today, and another one at 2 o'clock tomorrow. But generally, when people are inquiring, the first step is that I need to learn about them. I need to learn about the situation. What is their story? What are the challenges? What is the reason that triggered them to get online and do a search?
Okay.
So we start from there, and then once I learn about them,
Mm.
and the learning process expands. It starts with their story. What is their immediate need? What would be a secondary need? What is their financial situation? What would be the geographical area they want to be in? What are uh, if the family members are involved, what is the location of the family members? Um, are the parents making their own decisions? There is somebody else in the family making decisions for them. Are the parents part of the process? Do they know that one of the kids is searching around and looking around for try to find options for them either to move out of their home or to find some kind of a help? That is important to know. And and so once I get the detail, the broad picture of their situation and their story, then we can start talking about what kind of option out there would be a good match for them. And the idea is not to find an option that is good for them like right now,
Mm.
but to find an option that is good for them now and in the future.
Right.
And um, and then and then we see it. Maybe if it's an assisted living would be a good option for them. Maybe it's an adult family home. Maybe a memory care. Uh, so we go from there.
And like when you're recommending like any kind of senior care options for you, the people also like take a consultant from the doctors as well. Like they also recommend like that kind of facility they need to see, or according to your experience, you suggest them, okay, this one will be the best for you.
Well, doctors they always have a recommendation. Seems like, and it is accurate in most cases. I would say the doctor's recommendations. But I do find that many times when we get into the details of the story and the details of their needs and thinking to uh, trying to plan long term, the conclusion sometimes it turns out to be a little bit different than the doctor's recommendation. For example, finances, when they talk about with their doctor about their issues, their problems, their challenges, they talk only about that, but they don't go into details of their financial situation. When they come and talk to me, we talk about their challenges and everything, but then it turns out that there are no funds available or there are very limited funds available. So that kind of changes the direction of the approach sometimes completely. So um, that is the reason why in my conversations with the families, we get into the depth of the details to make sure we're making the right choices and we're going the right direction.
So, in your experience, because you like placed multiple lots of seniors to find their best home, so according to your experience, like whenever people find the home, they mostly consider the financial thing, or they go with the doctor recommendations, or uh, when they have like less fund in that scenario, what's the doctor recommendation and how you manage that situations? Can you explain, or do you have any experience that you can share?
Can you repeat the question? I'm not sure I understand what you're asking.
Okay, so like at like whenever you like place the seniors to find their best home,
Mhm.
place the best senior care options, so they have financial, so the decisions they took like depend on the
Meaning that they have money?
yes.
Okay.
Sometimes they have money, sometimes maybe they have issues or challenges with the money,
Mhm.
and doctor recommend them something. And so how you manage all these situations together, like what doctor recommendations, but they have less fund, and that's a challenge, and how you combine all things together, and how you find the best home for them.
Well, doctor recommendations, they're always important and I always take them in consideration. They're a certified, qualified medical professional. Um, and but then we talk about the details of their particular situation. Their every individual elderly that needs care or help, they get to that point. It seems that it's different for everybody. Definitely, there is not like one size fits all type of situation where there is a standard, there is um, um, a universal way to go about it. So a doctor visit sometime is 10 minutes or 5 minutes or 15 minutes, uh, where there is only so much information that can be shared within that timeline. My conversations with the families or the individuals, sometimes they're an hour, sometimes they're an hour and a half. So there is a lot more volume of information that is shared in our conversation versus just a doctor's visit. So I think that would allow me to reevaluate what the doctor said or what the doctor recommended, take that in consideration, but also make my own decisions on recommending and suggesting what would be the direction to take. Sometimes it matches with what the doctor recommends, sometimes it does not. And the only difference, I think, the only reason for me having a different recommendation than the doctor initially had is just because I gathered more information than the doctor did. And I think I'm more and better informed about the overall situation.
Okay, and it can also link with the financial things in the mind, like because of the financial situation, that direction is changed, like the with the doctor that recommend, or it is just like you experience and you find out something different, what doctor find it out.
Well, going back to what people generally know about the senior living and what they don't know. And many people, they just don't know what they don't know. And what happens is, the doctor makes a recommendation. The daughter or the senior, they think that, they have Medicare or they have another primary insurance. The doctor visit is covered by that. When the doctor recommends, well, you should go into an assisted living, many times people, they assume that an assisted living would be covered by Medicare as well, you know. So they say, oh, okay, we're going to assisted livings. We could be going to assisted living and the insurance would cover. Well, then they meet with me and they talk with me and they find out that the healthcare insurance doesn't have anything to do with senior living. And they're completely two separate things. And then going into an assisted living, um, it would be an out-of-pocket expense. It would be what we call private pay. And then when they find that out, they say, well, how much does it cost? Well, it depends on the location, depending of the company, depending of the care needs, your mom or dad has. And it could be, $4,500 rent for a studio or a one bedroom, and then you can add $1,000 care on top of the rent. So that would be 5,500. It's like, okay, we can pay 5,500, but we're, at some time in 2 years, we're going to be running out of money, or in 6 months or a year. And then we say, okay, the conversation then turns a turn and is, well, if there is a possibility that you'd be running out of money anytime in the near future or the future, then and you want to go in assisted living, that's going to dramatically narrow down the options because you don't want to move into an assisted living and then when you run out of money down the road, they'll ask you to move out. So it has to be an assisted living that is contracted with Medicaid, and they have a program that is called the spend down program. That means that the facility would say, if you pay us privately out of pocket for a certain period of time, and generally it is 2 years, or in most cases, it's 3 years. And if you pay us privately out of pocket for 2 or 3 years, anytime after that, if you run out of money, you go on Medicaid benefits, you're welcome to stay. We're not going to ask you to move out. So when it comes down to a spend down program and assisted living's contracted with Medicaid, then everything it narrows down to three options, four options maximum within the greater Seattle area. So so when there are limited funds, things are options are narrowing down. So maybe, but again, depending on the individual situation, maybe an adult family home would be a lot more appropriate just from a financial perspective because there are a lot more adult family homes than assisted livings out there. They're privately owned, so in many cases it is negotiable when it comes down to money, to the cost, and and how long somebody would need to pay privately before they go on Medicaid or before they run out of money. So just the financial situation sometime redirects the path that we need to take. That would be a good match for the particular individual and to meet their financial criteria long term.
That's a really good insight because, as you say, like most of the time people think like it is covered in the insurance, but actually you have to pay the out of money, and Medicare will not work in that scenario. Medicare and Medicaid, these two are like different or they are same. Can you explain a little bit about that?
So Medicare, it is a health care insurance. It is a government healthcare insurance, and it covers doctor visits, uh, lab work, physical occupational therapy, medical equipment, things like that. So anything that is healthcare related, then Medicare would cover, or most of the things. Um, but Medicare does not cover senior living. Somebody can be in an adult family home or can be in an assisted living. They would pay privately out of pocket for them living there, meaning the room and board and activities and transportation and everything, that's included. That would be an out of pocket expense. Now, if during their stay in an assisted living, if they have a doctor's order for physical, occupational, or speech therapy, then Medicare would cover that. Medicare Part B would cover the therapies, but would not cover the facility, the assisted living. Uh, Medicaid, on the other hand, it is a state benefit. It is a benefit that low-income people receive, and if someone is under Medicaid benefits, then Medicaid would cover the living in a senior living facility. It's either an assisted living or an adult family home. The facility has to be contracted with Medicaid, and um, and then Medicaid would cover, basically 100% of the cost of living in a senior living facility. Yeah,
Like,
but a lot of there is similarities in the sound of Medicare and Medicaid,
yeah.
and and I would say more than half of the people that I talk to, they uh, mispronounce, I guess, they say Medicaid when they mean Medicare and vice versa. So that creates a little bit of confusion as well.
Yeah, and that's why like I wanted to little bit emphasize on those two different uh, benefit providing for seniors. So Medicare is specifically for the health insurance, but you say like if people pay the out of pocket to the Medicare, so does Medicare provide that senior living options as well or not?
Are you talking about Medicare?
Yes. If people pay out of pocket, like you say, like if people pay out of pocket, like so Medicare will support uh for the senior living options, or I hear
No,
no.
no. So Medicare doesn't have anything to do with senior living.
Okay.
It's only hospitals, doctors, pharmacy, therapies, medical equipment, things like that. But Medicare does not have anything to do with senior living.
Oh,
Either someone is in a memory care, assisted living, or adult family home, Medicare does not pay for it.
okay. And Medicaid, you talk about like that is for like state govern and it is specifically for under like what is it like that's the income like for the low income group, the Medicaid.
Yeah, yeah. So Medicaid, it is a state benefit designed to help low income population. Yeah.
Okay, and people
And
have
and 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 Medicaid would cover what Medicare covers, meaning anything that is related with health care, and Medicaid would also cover senior living, meaning an elderly to live in a senior living facility or community.
okay. So my question is here like the people who have low income group and if they like put the money in the Medicaid, so they will get the full facility for the senior living options. But what will happen the people who have comes in high income group, so how they manage the senior living options uh as a financial, like does there any program for those group as well or not?
For people who have money,
Yes.
well, people who have money, they would pay out of pocket for their senior living option, whatever that is. But then when they go to the doctor, when they go to the hospital, when they need medication, when they need therapies, when they need medical equipment, and they have Medicare, Medicare would cover that because it's a healthcare insurance.
Yeah, but they don't have not any program like Medicaid where they can put the money and later on like it will cover all the senior living option cost. Is there any program or not?
The only option, the only insurance that covers senior living, and actually when someone get not just senior living, but senior living with care, it would be long-term care insurance.
Okay.
Long-term care insurance, it's a separate insurance than Medicaid and Medicare. It is a insurance offered by private insurances like Mutual of Omaha, or there are quite a few of them out there, and you pay while you're healthy and while you're younger and while your life is good and you don't need any care or anything like that. You pay a premium,
Okay.
annual or monthly, a premium, and that long-term care insurance, if somebody has an accident, if somebody gets sick, if somebody gets to the point either due to age or illness, they're not able to stay uh, in their house any longer and they start needing help with care, with daily activities, with personal care, with things like that, uh, then and they move into a facility, then the long-term care insurance that they've been paying the premium to for many years in some cases, you notify them, let them know that you need to start a claim, let them know what the situation is, why you need to start a claim. If somebody already moved into an assisted living or adult family home or Medicare, they need to notify the long-term care insurance what is the new location.
Okay.
Some paperwork starts to be exchanged. The long-term care insurance might send out a nurse to evaluate the individual, to evaluate and to make sure that the individual needs a level of care that would meet the criteria for coverage for long-term care insurance,
Mm.
and everything is matching and all the criteria is met, then the long-term care insurance would start paying for uh, for the facility and for the care the individual receives. Now, like any insurance, there are different plans that they offer. So depending the individual what kind of plan, long-term care insurance plan they chose, and depending on that particular plan, they start receiving uh, payments, reimbursements. But depending on the plan, is like how much money the insurance will pay and for how long and things like that. So depending on the plan they chose. But bottom line is that long-term care insurance, it is the insurance that would cover senior living with care. If somebody would move into an independent living, into an assisted living, into an adult family home, and they're mostly independent or they are independent, long-term care insurance would not kick in. Long-term care insurance would not pay. So the long-term care insurance, that's why it's called long-term care, because when care comes into place, care needs, care services, that would be appropriate for long-term care insurance. Yes. Otherwise, as long as somebody is independent, long-term care insurance would not pay.
Okay. And like that long-term care insurance is like comes under the individual, like every individual have the health insurance. So it comes under that health insurance, or we should need to work like talk to a different healthcare professional and we will talk about okay, we are looking for that kind of insurance.
Getting long-term care insurance, it is a personal preference. It could be recommended by people, but generally, many people they don't think about getting long-term care insurance because there is, it's the same thing like people not thinking about writing a will for their family or making funeral arrangements or buying a burial plot somewhere. Those are things that people think, this is never going to happen to me. I'm not ever going to need this.
Yeah.
Or, or it's out of sight, out of mind. They just don't think about things like that. But me being working in the senior living industry for so many years, it is obvious to me that my clients that I worked with, the ones that they do have long-term care insurance, financially, they're much better off than the ones that do not.
Mhm.
And in my opinion, uh, having long-term care insurance, it is the cheapest investment into getting financial help when it's needed because you pay, let's say, $2,700 a year, and in 20 years, you spend, you pay 50 plus $1,000 to the insurance company. But in 20 years, if you need to move into a facility because you need care and you want to stay within the greater Seattle area, that $50,000, $55,000 it could last you that you spent those 20 years for the long-term care insurance. You could spend that in 5 or 6 months, and then there's no money left. But you invest that $55,000 throughout the 20 years into this long-term care insurance. When you move into a facility and start needing help and money, the insurance could cover you for 3 or 4 years. So to me, in my opinion, this is the cheapest investment that someone can make to cover their care expenses when the time comes. The time could come much sooner than 20 years. It could be something happening in 5 years, 3 years from now. You never know what the future will bring. So it's good to have that long-term care insurance, in my opinion, and that is the reason why I got one for myself recently.
That's good to know. And also like that long-term care insurance only applicable in the USA country, or it will be applicable in any other country as well, or like all
I,
the.
I don't know. I don't know that, but it's something that I want to ask my long-term care insurance. I want to ask them, more details about that. Yeah, but I don't know the answer for it.
Yeah, because I just recently know like every state have like different rules and regulations. So if people know about, okay, if they are taking the long-term care insurance, so how it will work. And sometimes people have everything like in USA, but they are living in different country. So how that money they can like take, or how they can use that insurance in different country as well.
I would like to know. Maybe in my elder years, I want to live in Paris, or maybe I want to live in Rome, or somewhere. I
Yeah.
want to know if my long-term care insurance would cover my adult family home in Rome, for example.
Yeah.
We'll find out.
Yeah, so that way I think because everyone have their like different journey, different destinations, and we have no idea like what they actually wanted to do. So if when
Yeah.
people invest, so they would like to see okay how it will like who work specifically for immigrants like who are investing money in that area.
Yeah, it's I don't know the answer, but I will I will ask
Yep.
because I want to know. Yeah.
And like, is there any other options rather than long-term care, or this is the only option available in the USA?
There are some VA benefits and things like that, but I'm not an expert. If someone it is a veteran or they're receiving VA benefits, they should definitely ask their caseworker from the VA office or the VA office or somebody there. I don't know much information about that. I'm not an expert on it. And I'm not an expert on Medicaid either.
Mm.
What I know about Medicaid is general information. I encourage people to, if they want to know, uh, if they want to get accurate information about Medicaid benefits, what it covers, and all that, to contact directly the Medicaid office, the DSHS office, and talk with them.
Okay.
That would be the place to get the most accurate information.
Okay. Even you're not expert, but like you're serving the people, like you have like those kind of options sometime. So did you find like because you are like helping lots of seniors to find their home. So most of the time, what is the most common financials they have like they almost pay out of pocket, or they have some kind of insurance? What is your experience like when you are serving in your past experience?
Seems that it is a mixed bag, I would say, with a little bit of everything. There's a percentage of people with insurance, people who invested throughout their lives. They either invested in real estate or they invested in stocks and bonds or gold or other, you know. But there are also a large number of people that their only uh, source of money to cover their stay and care in a senior living place, it is their house, their home. And there are quite a few people that they purchased the home they live in or they've been living in the last 50 years, a home that 50 years ago they purchased for $30,000 or $50,000 30 years ago. And now if they sell it, they can sell it for 1.5 million. So that house, it is the source of their uh, financial backup, so to speak. They sell the house and they use the money for their elder days to live in a senior living, senior care place. Yeah, that is quite common in the greater Seattle area.
Okay.
Yeah.
That's good to know because sometimes people like don't have cash, like how they will pay, so they don't have any idea, like because sometimes maybe like people have one house they don't want to sell. So in that scenario, how the things work, that is like I have just curiosity because sometimes
It
maybe.
depends. I mean, I currently work with a couple, husband and wife. They've been living in downtown Bellevue in a condo, and they wanted to, I mean, they are moving into an assisted living. We already found a place. They are moving into an assisted living. But when we had the initial conversation, they talking about selling the condo, uh, and I suggested to them, you know, why do you sell the condo when you could rent the condo? And if you rent this condo in the middle, in the heart of downtown Bellevue, the monthly income you get from that, it would cover your assisted living costs, all of it.
Yeah, that's the
Or,
innovative idea. Like sometimes
yeah,
people don't think about it.
yeah. So they talked it between themselves and they decided to rent the condo, spend a few $1,000s in remodeling it a little bit and upgrade it, and they're going to be renting the condo and they're going to have an income, a steady income that will cover most, if not all, of their assisted living costs. Yeah. So there are ways to, when people have assets, there are ways to manage that in order to uh, benefit from it long term. Yeah.
That's like so nice because that is I think the people would like to prefer to expert because most of the time people have confusion like how they will manage the finance when they're looking for these kind of services or these kind of facilities because they think like they don't have money but actually they have money but they don't know like how to utilize it.
Yeah,
And
and the person who really can help with that would be a good financial advisor. And but this is one of the services that I provide. It's not just placement, but if somebody needs a good real estate agent, I can make a couple recommendations. If someone needs financial advice, I can recommend, a few financial advisors that I know they're really good and they helped other people before, and people that are very happy with the services they received. So there are resources out there. Uh, so many people, they just don't know what those resources are. But I'm doing the best I can to help them by providing them with a wide variety of information. That's why my services are referral, advisory, and placement services.
that's so nice. So I would like to share, like, can you share a story? Even we already share the condos couple story, but do you have any other story where they are facing the same kind of issue? For example, they like daughter like has parents and they need the facility, but at the same time they just have one home, daughter living with them and they have that kind of situation. So how does that kind of case come to your side, or if yes, how they handle that kind of financial situation?
There's a wide variety of situations out there. One thing I would advise is that if people sell assets and they and what one of the misunderstandings, biggest misunderstandings out there is that people think that, okay, I'm going to sell my house and I'm going to get, let's say, $800,000 I'm going to get for my house, right? And you are my daughter. I'm going to give you 300,000. I'm going to give my granddaughter 200,000 in their college fund, and I'm going to, give somebody else some money and things like that. And like that, I make everybody happy around me. And then I have no money left because I gave all the money to people around me. And now I qualify to Medicaid services because I have no money left. That is a big misunderstanding because a Medicaid application, uh, it's mostly about the financial situation. And Medicaid would ask the individual applying to give them their financial paper trail and proof for the last 5 years. And if an individual sold their house and they gave the money to different people, those people need to give the individual the money back, all of them, so the individual can spend the money for their own needs and care and things like that. Once they spend all that money for themselves, and they can prove it with receipts and financial paper trail, and then they apply to Medicaid, then Medicaid would approve them. Otherwise, Medicaid will not approve someone if that someone gives money to other people, and that's the way of them running out of money. So I worked with families before when I gave them that information. They were puzzled, they were starting panicking, kind of crisis mode kicked in because a mother, a father, parents gave money to a daughter or a son, and that was 2 years ago. The son and the daughter took that money, they bought a car, they bought a boat, they invested into something or something like that, so they don't have the liquid money any longer to be able to return it to the parents. And that kind of creates some new family dynamics and a new situation. And I don't have the answer for it. They need to figure it out between themselves how they're going to approach and resolve that situation. The bottom line is if somebody's got money, to not give it away to other people, to use that money to themselves until they run out of it, and then they would qualify to Medicaid services. But
Okay.
then again, the best thing to do is to call the Medicaid office, the DSHS office, and before you apply, just ask the questions or ask the DSHS office to give a list with the criteria that needs to be met in order to qualify to Medicaid services. Yeah.
So like the person like who have like you share a story like 2 years before, like the couple they gave the money to their uh son and daughter, like kids and grandkids, and they are not able to return the money. So that will happen, I think, with lots of families, and at the end they don't have money, they need the things, and they didn't realize like what will happen. So do you have any message specifically for those family, and what will impact if they do that kind of uh like that kind of thing, saying if something happen like that kind of situations happen, so how they will get resolved?
My advice is to, before making big decisions like that, meaning giving money, a lot of money to other people, is to consult a professional, a financial advisor, um, a senior living advisor like myself, um, an elder law attorney. And if there is any thought of any chance that somebody might apply for Medicaid benefits in the future, anytime in the future, it's good to consult with the Medicaid office as well to get some information from there. That's before giving lots of money to family members or other people. Yeah.
Okay, and sometimes people just wanted to get the benefit of Medicaid to giving that money. So if they need to pay the out of pocket instead of like getting Medicaid, but they have the same kind of situation. So in that scenario, what message you will give to the people? Like, should they need to give away money like before like using those facility or after using those facility? Like,
Well, you cannot give money in the last, so Medicaid will ask information for the last 5 years. So in the last 5 years, if you gave any money to anybody, large sums of money, uh, either a lot of money to one or two people, or a little bit of money to a lot of people, then they're going to ask, those people to give the money back in order to qualify the individual to qualify to Medicaid. So it goes back 5 years.
okay.
If parents would like to give a lot of money to a son, a daughter, to someone else, then they got to wait a minimum of 5 years until they would apply for Medicaid benefits.
Okay.
Yeah.
And if like it is just the kids, but if someone gave their all money to trust, what happened in that scenario?
Yeah, I don't know. That would be, there are this and many other scenarios that's why I'm saying consulting a professional would be appropriate. I would say most of the answers could be found by having a conversation with an elder law attorney.
Okay.
I think that would be the one professional that would be appropriate to uh, to give the accurate information to a variety of scenarios like that. Yeah, and I know a few elder law attorneys. I can recommend a few as well.
That is my next question because most of the time like people don't have any idea about like the elder law attorney here. So when people work with you, so you also work with elder law attorney. So when people need that kind of information, so you refer them and they will talk to the elder law attorney, and then they come back to you and make the decisions.
Yeah, it is. Sometimes it takes a teamwork to figure out a more complicated situation, or something that is a little bit different. So my role is my role is to help people. That is my main role. Everything that I do in my profession, it is to help people. It's either I can help them directly, or I can put them in contact with somebody else who can help them. So sometimes it takes a team in order to figure things out and get everything settled and uh, get it right, so to speak. Or sometimes I'm able to do that alone without anybody else's help. But when it comes down to laws, regulations, technicalities, things like that, that they're outside of my spectrum, then I can always recommend someone else. But the whole idea is to help people and their families, and um, this is the only goal of what I do, my profession. And my services are at no cost. It doesn't matter what it takes. It doesn't matter how long it takes. There is no cost to the individual, to the elderly person or their families by working with me or talking with me. I have actually a couple of people that we've been talking for a couple of years now, going back and forth with different scenarios, different questions, people that they're planning ahead. They're not ready to make a change yet, but every few weeks they have a new question. They're thinking of something, they're wondering of something, well, they pick up the phone and they call Tibi. And we have a conversation and then we hang up the phone and then we talk again a couple months later and things like that. So, um, but I never send them a bill. I never send them an invoice. So working with me, talking with me, having me 100% involved in figuring things out, it's at no cost to the individual or their families.
I just wanted to confirm here because your service is at like no cost, but when you refer someone like the elder care attorney or any facilities, people will pay those services, right?
Yeah, I'm assuming so. Yeah, I mean, if somebody wants to go to speak with an attorney, or uh, I'm sure there is a fee that they need to pay for the consultations. I don't know about financial advisors if they ask for a fee or not. I'm just saying about my services are at no
Yeah.
cost. Yeah.
Yeah, because I just want to confirm like when people see your episode or see your like this conversation, so they will not assume, okay, you're working in a team and they do not need to pay, but they do not need to pay to you, but they have to pay the other team members or the referral if they need any extra help.
Yeah, that's a really good question. Um, the recommendations or the referrals that I make to other professionals, it's not like, they're my employees, they're part of my company. There is no partnership agreement or anything like that. It's like if you need uh, a referral to an elder law attorney uh, because you need to figure some things out for yourself. And I had a family that I previously worked with, and they came up to me and they said, you know what, we've been working with this elder law attorney, and this is her name or his name. And we were really happy. We were very satisfied. It's a really good attorney. I might get that information and I might call that attorney and say, hey, this is my name, this is what I do, this is what my company does. I just heard some excellent feedback from a family that you helped. Is it okay if in the future I can refer someone to you? And that's how I get um, um, the people I would potentially refer to, people that I know they did a good job with other clients that they had. Yeah, so they're not part of my company. They're just outside resources. Yeah.
Um,
And if they charge for a consultation, uh, that's their thing. I mean, I have nothing to do with that. Yeah.
I just want because people always curious because you are giving like lots of information and people talk to you and you're not taking any uh like your services like are free at no cost. So how you will get pay? Because sometimes people think like it is a scam or maybe they will ask like there's some hidden amount of money. So can you just explain like why your services are at no cost and how you will get paid?
As I mentioned before, it doesn't matter what it takes, how long it takes. Helping a family, working with a family is at no cost to them. Um, and that's how I make a living, not charging the clients that I work with. How I ultimately get paid is that if that individual moves into a senior living community, senior living place, um, that was referred and recommended by me, and I was the one initiating the referral um, to that community, to that facility, then the facility will pay me a referral fee. That's how I ultimately get reimbursed for my work, for my effort. The facility will pay me a referral fee. Um, but until someone moves into a facility, I don't get paid. My services are at no cost, yes, to the client.
Okay. And then in the last, like, what is one tip that you wanted to give your audience, uh, like to better financial management for their long-term care or when they need those kind of facilities? So, what is one tip that if they do it today, so it will help them tomorrow?
One tip would be to not assume things, but to find the real and accurate answers. And my recommendation would be, if someone is planning on 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 being covered financially in the future, when the time comes, if the time comes, uh, my recommendation would be to speak with someone, with a broker that sells long-term care insurance. And just have a conversation, ask questions, get the answers, and then make a decision if it's something that you want to do or not. But I do recommend people to look into long-term care insurance and to consider that as a good option to be financially covered for the later days.
Thank you so much for your time. And today we get lots of information. And I always love about like your experience and how you help seniors. So thank you so much, Stevie, for uh, chatting with me. And in the last, how people can connect with you or they can reach out to you.
It's very easy, very simple. You just look at a1seniorcareadvisors.com. That's my website that was built for educational purposes. So a lot of people who go in there, they find many answers that they're looking for. And also by phone, calling me directly at 425 324 5592. 425 324 5592. That's my number. It comes directly to me. You can call me anytime. I am doing my best to be available during the day, evenings, and weekends. So if I have phone signal, most likely I will answer the phone. So feel free to call me. We can always have a conversation.
Thank you so much. And it will definitely help lots of people.
I hope so.
Yeah, it's definitely. So thank you so much. And here's our interview done.